data. We do have, like we've mentioned, a stock of different platforms of vaccines. When we do our projections, we see the risk of, if Kenyans don't show up within the next 3 weeks, there will be another 1 million doses that may possibly expire. And this is of a different platform. And so the issue of expiries and the risk, rather, of expiries is not just about AstraZeneca. It's all the platforms that we have. And so that is why we saw it very important today to come, to talk to Kenyans, to share with them this current challenge that we have, but to ask them to work with us in ensuring that really we do not waste those doses, because it will be such a shame to have had all those doses available, the effort that went into mobilizing them and having them availed in the country, and then to have us then lose them through expiries. In terms of waste, I'm proud to say as a country we have a good waste management policy, particularly for health products and technologies. This is an issue that the country has been able to deal with in the past for years and years in the years past. Remember, we have many other commodities beyond vaccines. We have drugs, we have surgical outputs that we use, we have non-pharmaceutical products that we use. So Kenya knows how to dispose waste. And so there's a mechanism of how we do it, and it's one that's guided also by the International Code of how to dispose medical waste. Dr. Akwale, if you could share some information.
Okay, good afternoon or late early morning, and thank you, Kaz Mwangangi, for ably taking us through that statement. I will just touch on especially the question, is it only AstraZeneca that has expired so far? Yes, it is only AstraZeneca. We have a standard operating procedure where by the 10th of every month, we require counties to give us their stock status from the facilities. The facilities report to the counties, and the counties report to the National Ministry of Health. And in that one, they tell us how many vaccine doses they used, how many were wasted, and how many have expired. So we had, as clearly stated, about 2.2 million AstraZeneca vaccine at the beginning of January. And by 28th of February, 843,000 doses had not been used. And these ones are therefore expired. So we received this information, consolidated it last week. Out of this, about 570,000 were in the regional stores, and 270,000 were in the facilities ready for use. So yes, so far it is only AstraZeneca. However, as the CAS has stated, we have a potential of expiry of J&J by 15th of April, about 1 million doses if they are not used. And let me explain J&J. If stored at minus 20 degrees, the shelf life is 2 years. However, you recall that in December, we got 5 million doses from the government of Germany. Minus 20 degrees cold chain is also shared by Moderna, and that time we also had a lot of Moderna. So we thawed means you remove from the deep freezer, ready for use. J&J is popular. The demand has always been high, especially among young people. So we expected that we can use all these doses. But from what we are seeing now, if people don't show up in the next 3 weeks, up to 15th of April, there is that danger. We are going to do our best in terms of communication. We are especially going to try and reach in colleges and institutions of higher learning, and hopefully then we'll utilize all of them before their expiry. And we'll be seeking your support to ensure there are no expiry by encouraging Kenyans. The game is not over until it is over. Then finally, just on the disposal, the process now is we already alerted COVAX on these expiries. We are going to collect all those expired, and we are going to use centers that have incineration so that they will be banned, so that they are not a danger to the environment. Thank you.
One more question?
One last question for clarity. When you talk about Dr. Kwale, when you talk about we have a possibility of 1 million J&J doses set to expire on the 15th of April, we acquired J&J with our own money as a country. So what does this mean for the projection of the taxpayers' money moving forward? Did we acquire this vaccine
Absolutely not. The government acquired J&J are not at risk of expiry. I want to assure Kenyans that. In fact, so far, 897,000 doses have come in country. We were to receive 1 million. We've stopped it because we got 5 million doses of J&J in December. That's what you should remember. It is that donation that is at risk. The initial ones that came went like, they really, and the few ones are stored, especially in North Kenya, at -20. So no expiry at all. We continue, and the demand of J&J is there. Our only worry is this, what you call low perception risk of infection because of the low positivity rate. There was a time, and you people know 1 year ago, people were like, bring J&J, that's when we'll show up. Now that has gone, and that's what we are calling complacency. And unless that is corrected, even with our best intentions, then we will definitely be having a challenge. It's important to remember also, we need many more doses. So the government had to invest in this. And the investment is because we have to meet certain targets. We need 19 million Kenyans fully vaccinated by end of June. We need 27 million people. If you consider all that, we cannot only depend on donations, and therefore the need to have that. We are going to do our best to manage the supply chains, calling them when it is very necessary, so that we do not go into expiries. Thank you.
Fantastic. Thank you, then. So remember the call to action for yourselves. Talk to the Kenyans and let them come forward and get vaccinated. It's very important, and you're such key strategic partners for us. So we really, really want to see you, and I can see you, Ben, and the rest. We want to see you speaking about this, tweeting about this. Let Kenyans come forward and get vaccinated.